My sincere regards to our Honorable Dr. Ismail Sait Saham. Sir, what about your health now?
Okay, sir. Okay, sir. No problem.
Okay.
I'm managing it. Managing it with the best and everything.
My
And
pleasure.
with
It
my
is.
travels also I cut shorter. All travels I cut shorter. But one next Sunday I have to go to Coimbatore because I am absent there since last 3-4 months. So that day I should go there. So next Saturday evening I am starting slowly and get rest there. And Sunday I will look after my patient. Came back the same day evening, same day night.
Yeah.
You will get some comfort, that's all. Meantime, I have to come to Trivandrum to some other official matter, but I cancel. My friends also advise me to don't come. Anil Kumar and Babu, Shaji Kujat, everyone is advise me, don't be traveling. Because my 5 vertebrae, L125, only 2 is escape. That is intact. 1, 3, 4, 5, 6 is a severe compression. Severe compression. Because I had 2 accidents. One by a car accident and the other one slipping in the plow. And after taking some medicine, it will okay. I not minded later. Later, last 2-3 months back, I got severe pain, referring pain to my limbs, even the fingers. So I took the MRI, then only I found out this much of dangerous is hidden here. After that, I taken test and avoid all the travels and everything. Okay. No problem.
So, Dr. Ismail Sait, sir, can we start the session? I guess everybody.
Yeah. Everybody there, eh?
Yes. Most of them.
Okay. See, first of all, I'm telling you, in chronic cases and acute cases, our motivation is the highest ideal of the physician is high and only mission to restore the sick to health. Physician is high and only mission to restore the sick to health. Suppose early my practices, I got several typhoid patients. They are getting to my treatment and getting cured within 5 days, 6 days, 7 days, like that, with the comfort. There's no sickness further. So there my allopathy friends also accused me that is not a typhoid one. So I disappointed. So I found that even after curing of typhoid, the typhoid bacillus will remain 7 to 15 days. So I took the this one blood samples. I found this bacillus is there. That I shown to my friends, local friends, and as well as my friends. So I make myself confirmed. I treated the homeopathy treatment. I given the typhoid cure. That's why the first principle was we achieved. High and only mission to restore the sick to health. Whatever the sick we have earlier, we should restore back to the health condition. Then only we can say as a sick. Then only we termed as a cure. So this is a very fundamental to all acute cases. All acute cases. Even renal colic and real colic, because suppose real stones are expelled and a gallstone colic that also expelled. Then only we can say. And appendicitis. Definitely we can say the restore the health. Myself, I had one appendicitis during my last years of my college life. I think 2002 or 1. Yeah. I got severe attack, renal colic. And I wandered here and there and I profusely sweating. I called my friend Ramesh, KP Ramesh. He came and given the tobacco. It was the symptomatology of this sweating profusely with the colic, renal colic. He was given the tobacco, but no use. Nothing was happened. And after that, he given the beribase vulgaris and other pain remedies. Even belladonna he is repeatedly given. No relief. I am wandering here. One time, I took my coat myself, hold it and came down. Due to the pain, the severe pain, I hold my overcoat, double coat, no? I hold it in one hand and leave it. After that, one or two students are, after homeopathy, they go into allopathic state. Just go to MBBS. They also came by hearing my holding. They have taken the allopathic medicine for injection. Sir, why should you are making this much of something? You take an injection, you will correct it. We need it, your health. That's why we are requesting. Okay, I am agreeing because I find this much time and I am. Then let me go to my bathroom and I come back. I went to the bathroom and I meditated myself. I saw that I was a madman. I was a madman during the pain. That's why I hold this in my double coat bed and hold on. And a pillow, I steer my pillow. Everything I showed the madness. The mad pain during the mad pain. Only one medicine in the America, that is nothing but Ignitia. Ignitia. So I asked Ramesh, could you give me one dose of Ignitia 200? Ignitia? He just taking the face and asked me, Ignitia? Yes, Ignitia. So my pharmacy also nearby. They took the Ignitia 200. I took it. Within seconds, no, he said, the water is just down, go back to my throat, pain relief. After 2 minutes after, I myself, Dr. Ramesh and other Mohan Kumar and Ajay Kumar are sitting together and took the tea. It's a wonderful story I'm telling by sharing it with you, because every symptom you should correct it correctly. Then only we can manage the acute cases. Otherwise, you will fail. We will refer the case to other schools. But if we need it, suppose some muscle guard is cut. My muscle guard also started. That's why they are asking me to take the Baralgan injection. So, due to my symptomatology, I find out I need Ignitia. So, Ignitia is the medicine for any kind of pain, where the patient showing the madness signs. It's not tolerating the pain. He jump here and tear the clothes, tear the pillows, and take the wife and the children, everything I told. I put my wife aside. She didn't side me because he came for a consultation. The consultation also aggravating. That is Natramil coming. They see Natramil also coming, but Natramil will not work it because acute symptom is with Ignition. That's what I story I'm telling and beginning my class. Thank you very much for listening this one. The acute disease and its homeopathy management. This is 72 aphorism. Rapid morphic process of the abnormality, the range vital force, which have a tendency to finish their course quickly, but always in a moderate time. These are termed as acute disease. Of course, 72. This is our acute aphorism of the acute disease management is there. Along with, you should add this one first aphorism number 1, number 2, then only the cure will come. What is the aphorism 2? The written highest ideal of cure is rapid, gentle, and permanent restoration of the restoration of the health, or may remove all annihilations of the disease in the whole extent. That also be admitted here. Then only we can say, I cured a case, I treated a case well. So, is the aphorism is behind it to understand the acute disease of the children. Nouns of prey. In infant, no? The age of 4 years, 3 years, less than 1 year. They are crying unnecessarily and without any cause showing it. Without cause is showing it. Crying and crying. But anyway, so allopathy doctors, anyway, homeopathy, they're telling homeopathy is good for the older children and only infants and children and women. That's fancy. So homeopathy symptomatological relation is very related with our treatment. See, the older symptomatology we are treating. Of course, we are diagnosing it. Acute angina we are diagnosing, acute cholecystitis we are diagnosing. All the we are diagnosing for the purpose of the advices and management. But treatment is goes with a older symptomatology. So here the symptomatology, verbally they are telling by the adult people. Then only we can treat well. It's instant. In the infant, how they say that they are completely due to something. We should observe it. Suppose there is a earache patients coming with the baby coming with the mother and crying and crying like that. Between that crying, he shown the rubbing of the ears. So we should understand it is due to the ear pain. And due to crying and he chipping, and like that grinding, even that they are not having teeth, it is due to the gum pain or tooth pain or the teething pain. And lack of attention for the mother. Suppose mother is an employee, he is going to office very earlier and came late. By meantime, the baby is annoyed because the feeding at this crying, starting crying. The mother-in-law and the grandma, grandpa, and other sisters are giving the milk and everything. This is the reason, definitely, because the child needs the mother's attention. So that attention should be given for recovery of the pain. That also we have to advise the mother. You should observe the child whenever you came in. Of course, you are having a job, you don't leave the job. But that also you attend to the good child. The teething pain, I told you like that. Then nose block. When the acute nose block comes, pain is, that is crying unnecessarily. So then you have to find whether this is a pain. You have to give arsenic amalgam or sambucus or even belladonna. But it's easily manageable. Ear pain, we have to give any pain, tooth and nail, you unnecessarily crying. Chamomile is the medicine. Chamomile 200 will, 1 drop or 1, 2, 3 globules you put into the glass, half a glass of water, give it in up to a quarter teaspoons every 10 minutes. After 2, 3 doses, the child will stop the crying. Because that much of severe pain was there. So chamomile is the pain and the nose block we have to attend there with the sambucus and arsenic amalgam and the belladonna even like that. See, this girl having the acute otitis media, most commonly due to the Streptococcus pneumonitis and the Himalayan influenza. Severe pain, no? But the child, grown-up child, he shows the pain here like that. So we have to see the other symptoms. Whether it is otorrhea is there, whether it is otorrhea is a very thick one, or watery one, or pussy one, or bloody one, we should observe it. According to that observation, we can give the proper medicines, like Mexol. Even chamomile we can give without any discharge. Severe pain is there, child annoying. Here we can think about the chamomile. Mexol, we can think about the Mexol. Suppose any pussy discharge is there. And any putrid discharge is there, offense, you can think about the pulsatilla. So pulsatilla, what is the character pain? Gradually is coming. Yeah, the pain, the child is starting slowly. Like that, it started, then loudly crying. That's character of the pulsatilla. We can observe it, closely observe, then only we can see. None of the case will fail. Suppose we are observing and give the proper medicine, none of the case will fail in the OP section. Okay, so gradually it is coming and getting the maximum and declining suddenly. After giving a medicine, or suddenly the relief. The suddenly they stop the crying again. But other complaints, other pains, the pain is attended with the chillness. Chillness. That's the abdominal colic. Suppose appendicitis pain comes. Suppose we are asking how it comes. Starting growth slowly, getting in the peak with the shivering of my body. Then also we can think about the person. Then sudden declines, even after medicines or after the automatic declines. But then the automatic decline, the pain will come again and again. After 15 minutes or 20 minutes, the pain comes. Then also we can manage it. So then ear pain, we can manage with the pulsatilla, we can manage with metronome, we can manage synesthesia, you can manage with the chamomilla and pulsatilla. Okay. Infants may present with incessant crying and irritability. The irritability is there. Even any child, even the grown-up child or the small child, even the adults, when we see the irritability with the pain, there we can think the impatiency. They can think about the chamomilla. They can think about this one Ignitia. Ignitia is a wonderful one. I am very big pain. Ignitia. But Ignitia very small, very innocent medicine, no? Ignitia. Even saying all the Ignitia. Very presently saying the word Ignitia. That's all. But Ignitia is very wonderful, very aggressive to the pain. Aggressive is very much in the Ignitia pain. Chamomilla is not aggressive. Chamomilla with irritability is there. Irritability is scolding others. Very harsh words is using with the pain and something. So irritability is there. So medicine is, I told you, when verbascum pain is wonderful pain. Verbascum, the discharge is very thick, very thin, and thick also coming from the ear. And even the nose block also, they are having the block of the nose with a thick pustule discharge. And hepasulf also, you can know that. Acute abdomen. It could be a manifestation of hunger. In children, no? In children, grown-up children, 5 years old, 6 years old, 7 years. Nowadays, the children are fond of this fast food. They doesn't want any normal fast food ever. After getting the fast food, they go to the indigestion. That also is every day the child is having the crying with pain in the evening hours, because every day he's taking the chicken or this one medicine, what's the chicken tandoori chicken is there. Chicken is there, and all other items is there because they are adding the Ajinomoto. Ajinomoto will irritate the colon. It irritates inflammation of the stomach. So always they are getting pain. Ajinomoto. Because of tastiness, Ajinomoto, they are adding all the hospital, all the hotel people. Without Ajinomoto, they are not feel tasty. So they are adding it. Even the attendant, we are not using Ajinomoto in front of the water, but they are using it. That's we found some cases like that. Then improper feeding. Mother is very hasty, very hurry and eating, giving the feeding suddenly and going to the hospital. So the subject is patients always the comfort feeding they need. Comfort feeding. I know one child is refusing the breast milk. Refusing the breast milk every day. They never allow to not taking it. Crying, but not taking the sucking the breast. Why? Because of the mother having the sweating of the husband, sour smelling. So after that, I jokingly said, do one thing. One day you just take bath and give the first milk. They done it. The same day the child was taken the milk properly. After that they practiced because the bad smell for the body or acceleration by feeding. The child is not tolerating that one. That's why it happens. And some child having this bitterness of the breast milk. There also we can have the medicine. Calcarea carb we say. The other medicine also calcarea carb we can administer, but taking bath is very essential. Calcarea carb 1 hour, 10 hours give, and definitely the child will suck the milk properly because of the very bad taste of the milk. Maybe the mother had taken the smoked fish or some other fish like that. The child is not tolerating that one. That's why. In that way, we have to advise the mother to avoid this much of this beef you have to avoid, or smoked fish you have to avoid. Something jinga, that is prawns, you avoid it because it will make the body pain in that child by taking this milk. See, we are also what we are really immunization. Immunization, what we are doing, we are giving the medicine to mother, not giving the child. Because due to the feeding, the child gets immunization. As all we are giving the mother, both the mother and the child having the immunization. Am I right? Yeah, take that. Then somebody is having cow's milk allergy. Somebody is having the milk allergy. The itching is coming. After some time, they refuse milk. I heard so many cases. I said so many cases like that. Because after taking the milk, the allergy comes. They gradually stop the milk. Yeah, how much have you given them? Only 2 months they should taken. Only 3 months they should taken because of this one. There also we can give them medicine allergy to milk. There also we have the same our calcarea carb medicine comes. Calcarea was a wonderful medicine for the feeding, diabetes, all anomalies. Cow's milk allergy, the bitterness of the milk, and the bad smell of the mother. Everything we can control with the calcarea carb. The lactose intolerance. Then also we can think of. There we can think about the pulsala too. Pulsala also. The 30th potential pulsala will get the intolerance, remove the intolerance. But you have to give the calcarea finally. Then only you come. Okay? Then physiological immaturity of the intestine during the early infant. So nowadays what happened? The children, 9 years old having menstruation. 9 years having menstruation. I found several cases because of this one fast food. Fast food having this contaminated things are there. They are early in the menstruation. What is the normal menarche age of the Indians? 11 to 12. 11 to 12. In my childhood, I found my sister and others having the 13 to 15 years. After 15 also dangerous. There we can think about the pulsarilla. If early come, we can think about the calcarea. Okay? So the very early menstruation. And due to the menstrual development, the pain, having the intense pain during the early infancy. There you can give the counseling of the mother to remove the anxiety because almost the mother, even recently the mother was come from there asking, my child is worrying about it. He's only 8 years old. I asked him, what is the cat of the culture? I found out this sexual matter is there, prestige is there, and the filtration is there, everything there. I asked him, within 6 months he will get menstruation. 6 months. 6 months. By 8.5 years. Yeah, possible. Because they are giving the all Ajinomoto drugs, Ajinomoto foods. That's put everything. He's asking the kura, you are giving 2 packets. Suppose the child demanding 1 packet, you are giving 2 packets of kura. Kura, you know that what? Very dangerous. This chips items or prawn items coming from the North India. Because they are doing the business. They are doing the business. They are not making any, what is it, general things to the things. They are making money also. That's all. Even your COVID vaccine, what they are thinking about? Making money, that's all. Everyone knows. Nowadays, it's very dangerous, no? Every day I'm getting, sir, I'm having aggravation of the pain, having the headache pain, migraines, aggravation. And what I didn't want to, whether you're going to travel? No. Yesterday, also, when lady comes and she's taken the medicine for the osteoarthritis, the pain was aggravated. I mean, whether you're going to any travel and no, I'm taking that. Then what is the expression? I took the vaccine. After I took the vaccine, after that the headache was come, then pain also in the next one. All acute complaints are aggravating due to the taking of the vaccination. But we can't agitate with this one. I'm asking you take the vaccine, no problem. But these are the things. These are not a proven one. Not fully proven one. Only 61%. And along with that one, the side effect also there. So you do one thing, you depend on homeopathy, take homeopathy medicine for a prevention. After take for waiting for another 6 months, 1 year to get the good vaccines. So that we can think about that. I'm saying like that. You wait for the good vaccines. Nowadays the vaccines are very dangerous. Good vaccine, you wait for it. After 6 months, 1 year, you can take. Up to that time, so everyone compelling me. Who are compelling? Who are compelling? Not doctors. This Anganwadi teachers or some other ladies having the below SSLC doing the service. That type of ladies are compelling them to, because they are promoting that they're sending such a people to promote the vaccination. That's right. Then counseling should give the mother, and the baby should feed in the upright position and angle of the because the gas is formation comes, so escaping a gas allowed to then tilt the back so that the parabolic sound is coming from the mouth of the child or their passing fracture. They get relief. Should plan to the head bed on the right side, laying the place on the right side. Right side laying as a good. That's why some religions are asking everyone to lay on the right side. Should be planned in the bed in the right side or recommend position, bed position 10 to 15 minutes. So that the escaping of the gas will happen and it gets relief. That's what the Jalapa, what you mentioned? Jalapa is crying every day. Every day he sleeps perfectly. All the night he sleeps. Then he is crying. Child crying all the night, sleeps all the day. That's the Jalapa thing. They go about him. The crying starting by evening to night. And there is a funny thing. He said, when I was practicing in the Manajeri, 1971 and 22, and one lady is coming, sir, suppose we are starting our azan by 4 o'clock, the child start to cry till the Esha azan is up. It's at 4 to 8. There you can see on the neck of audio. So the funny things that happen to them. They are telling the correctly, but we have to convert this into our mathematical model. Take a word. The Sorna also the chronic crying patient. Because the irritation of the skin, they are going to get the eczema or dermatitis. That's a sign. That's a sign. Suppose before starting the eczema or psoriasis, suppose we are giving a dose of 200, very minor doses, so now the graying also will stop and they will prevent the skin complaints. Very main symptom. Suppose we are examining the child, the skin become very dry. They dry and looks ugly also. Sorna. Sulfur not like that. Sulfur is even then they're not taking bathing, they look fair. But Sornam not fair. Ugly look. Wrinkled skin and ugly look every day. That's a Sornam issue. Maybe due to the dislike of taste of food. Bad taste in the breast milk. We discussed earlier. Due to the painful ulcers in the mouth and blocked nose. This also we discussed earlier. The child milk, the mother milk is very soury and like that. Like to take the one crying because they're angry. And then one of the child recently came to me. They're always crying and always want food or water or milk, whatever the liquid food is here. Every day. Suppose they are giving it and chopping this one, again he offered. I given a dose of Adam, 200. The next which they are telling no other complaint. Now they are taking the proper milk. Not demanding any further milk, not demanding any further food like that. Only one dose of Adam must be given. And Adam in the childhood and in the chronic case also, they eat random, frequently they eat. After half an hour, after 1 hour, after 2 hours, they need food. That also go to Adam. The ulcer of the mouth. Suppose the child having an ulceration in the mouth, they are not sucking the milk because the pain. We should examine, you have to give the medicine, wonderful medicine, accentuating. Because severe pain is there. Severe scalding pain in the mouth and gums. Accentuating 30. 30% is enough. Not go for high potency. 30% is enough for the recovery of the pain. The same day they will child will suck the milk. No problem. Then blocked nose. That's also I will do. We discussed earlier. Yeah, we will discuss this one. Calcarea for the mother to improve the quality of the milk, breast milk. Suppose I'm telling between that one. Suppose they are telling, sir, I am not having breast milk. Child is crying and they are giving the lactose and one and other food. They are not having milk. There, I can give a wonderful suggestion for you. Write down, don't be forget it. Take 5 badam. You know badam? At least one should say, yes. You know badam? Funny. Badam 5, cashew 5, 15 numbers of this pista. Not dry pista, not smoked pista, original pista. Then 1 tablespoon of the cotton seed. Cotton seed put into the water separately. Other things are separately. Night, in the morning, just peel out the badam's skin, peel out the pista's peel, and the cashew will become soft. Then you just clean the cotton seed. Only you take the green color seeds. Only. Maybe the half person will get what quarter of it. That's enough. That's enough. You mix it with the cow milk or goat milk and mix up in a mixie. Then add the milk, then boil it, give to the mother for 10 days. 10 days only, enough. 7 to 10 days enough. she will produce plenty of milk. Plenty of milk. I jokingly am telling you can sell it out after giving your child with plenty of milk is there. Sell it outside. Those who need it. I'm telling that joke. Okay. There's a clue I'm giving you. I think everyone write down. Note down, eh? Note it. Got it. 5 badam, 5 cashew, 15 pista, then tablespoon of cotton seed. How to prepare it? Cotton seed you put in the separate water, and other things you can separate water. Then peel out the skin and only collect the cotton seed, only collect the green color. The yellow color, everything is removed. Only green color you collect it. I know this pista and badam and this one cashew, and mix it with the milk, the mixie, then boil it and give it the 7 to 15 days. All year you will get the milk. We have medicines of course. Asafoetida is there. You know the asafoetida or kayam. Asafoetida 30. The wonderful medicine for making milk, plenty of milk. But this milk, I'm told about this one. We will get a very healthy milk. Healthy milk. Pista, badam, and cashews. And cotton seed milk is very healthy milk, no? That is the first of all, you just think about that one. Then lycopodium. The child is not having proper appetite. They complaining that my child is not taking food properly. Then sometimes they are asking, what are you giving to the child? Morning I am giving him 4 or 5 biscuits, Tanya biscuits, 1 glass milk. And again I am giving by 10 o'clock 1 egg. Again I am giving by noon, by 12 o'clock 1 banana. What they are demanding, they are not taking rice. They are not taking chapati. But all the things they are taking. So they are asking them to reduce the food. Give half banana. Give half this egg. I am suggesting like that. By job. And suppose they really they are not taking food. We have a wonderful medicine. Wonderful medicine we have it. Only 1/20 of dose of lycopodium 200. 1 drop lycopodium divided in 20 parts. Give the mother and asking them to give it every 5 days. Every 5 days at night. 9 o'clock or in the morning. Only 1 dose. Yeah. After 3-4 doses, the child is start to eat proper meals. Note other thing, naturally the dose of appetite. You can get it. Even adult and tried it one. Even adult they are not having the proper lack of taking the food. We can also there also we can. Then glycerin. Suppose we are giving the proper food and everything there, they are getting emaciated. To improve the body, we can give the glycerin 30. Glycerin 30 daily, thrice daily for 1 month. See the difference? Within 1 month, they improve 1 or 2 kilos. 1 kilo at least, they get it. Okay? Then, discomfort from the teething may begin as early as 3 months. The gums around the emerging teeth may be red and swollen. Is another thing. If you are crying and the child is crying unnecessarily means due to the teething problem. We have wonderful medicine, no? What is the medicine? Kamavilla, Jalapa, Sornam, Calcaria, Silesia. These are the due to the confusion. But without asking the constitution, we can blindly prescribe Camomilla, teething complaints. Child having the early teeth. Nowadays, the child after delivery also getting the teeth. Immediately after delivery, or the child is born with the teeth. I found the cases like that. Suppose somebody is not having the teething even after 6 months. There we can think about the calcareous force or calcareous car. Calcareous force is wonderful medicine. And meanwhile, I'm telling one story of getting the height for a dark children. But you select the child below the 12 years old. 12 years old. Definitely we get the height. Every month they give calcareous force 1 arm, 2 doses. 1 arm, 2 doses. Every month you give. Within 3 months, they will start getting height. One child came to me, one girl came to me, 122 centimeters. Now she got the 148. That means 46 centimeters got within 1 year. So this practice I am doing in every deaf children. Below 12 years, Pakka, they got improvement. After 15, 17, difficult. They 15 also are trying. One of my friends, mother-in-law, 15 years old. He got also hardly 1.5 centimeter after 6 months. So that age is not good for the developing the height. So select the child below 12 years. Get that. That also I am giving to my experience. That's several years. I'm sharing my experience. Okay. And that is gum injury, gum chewing the plastic or rubber toys move the hacking gums, chewing all things and rubbing and eating the egg. There also we can think about this one. There also you add the acid nitricum and buxol. And fever and febrile. Controlling a fever, very, very great thing. Suppose a homeopathy doctor control the fever within a short time, he become a very good practitioner in the future. Very good practitioner in the future. Because a non-specific temperature was there. We can't control it very soon. Then also we have some techniques. We have the complementary medicines. We have the mathematical medicines along this one. All the techniques are also there. Sornum, Mathlinum, sulfur, tuberculinum. These are the medicines for in between the proper medicine give. Fever will come down in no time. And the technique there, pyrogen 200. Whatever the septic fever comes, you are giving several medicines are given in 1 or 2 days over. Give the pyrogen 200. 20 doses. Don't expect any improvement within the dose of 10 years. 10. After 10 years, getting it. Such a medicine, other medicine also there. Phosphorus 30. Phosphorus 30. There also we can give 1/20. 1 drop into 20 doses. I'm giving it every hour. Every hour. Definitely after 10 doses, will come down. Due to the agony, due to the fear, mother asking, sir, we are given 3 doses. More improvement. I mean, nothing will happen. Don't expect any improvement within 10 hours. After 10 hours, you expect it, you will get cured. So after 10 the potency, 10 to dose, you got a reduction of the fever and completely will go by the 20 dose. That's also my experience. This pyrogen as well as is phosphorus. Phosphorus is a wonderful medicine about the non-specific temperature, controlling the temperature. Then another technique is there. That was taught to me a non-qualified doctor, Dr. Solomon from Alleppey. He is giving the higher temperature patients, giving for a force every 15 minutes, 3 doses, followed by calcarea salt. Calcarea salt, 1 dose. Then ask the mother to wrap the child to the cumbal. So after cumbling, if the child is getting profusely sweating, the temperature will go. I am also experienced several cases. That knowledge was got from the non-qualified doctor, Solomon. When I am studying the homeopathy in the Alleppey, they are only unqualified doctors are there. John, Solomon, and and Vasavan, like that. They are my friends. Yeah. Even then, I got the qualification on the diploma colleges. We are conducting the seminar in every Saturdays, sharing your experience. The non-qualified doctors having the several experience that they got. We are sharing it that time. Okay. Then sugar public conversions here. These are the medicines. Arsemalbum, antimonium. What's the fun of the antimonium childhood? It's a very wonderful medicine. It was escaped, it was saved a double pneumonia patient. Double pneumonia patient in our hospital. One child was admitted in our hospital. One of the senior most doctor was seeing this patient. He is given the bryonia because the bryonia symptoms are there. Given, but the same day the doctor was took leave and gone to his country. They asking them to we to see the patients. Then my senior most doctor was there, Armo was there, Philippos, who was no more now. He asked me, this child, Ismail, let's see this child. She's going to die, double pneumonia is there, hardly breathing, breath is not proper, temperature high, is going to die. Okay, we'll see. I went there, I took the pulse, I examined the pulse. Immediately the child was staring at me and giving a blow to my hand. Immediately I given the antimonium 30 potency. After giving 1 dose, the pain fever came down and breathing properly gets. And after that one, I started the antimonium few more doses. The second day morning, the child was completely all right. That's my history of antimonium. While seeing the pulse, any comatose child is looking at, staring at us and blow it to us. That's the symptom of the antimonium. Go to the Metromedica, read it properly, consciously, you will get the same symptom. Okay? Then, Acute is also wonderful medicine for controlling fever. But usually we are all giving the Acute tincture, no? Even 30, 3x, all getting improvement, getting good for this one. Then China, the Chindamarch is another wonderful medicine. Suppose we are not having the controlling of the fever by giving Belladonna, Bryonia, and other medicines, everything. But think about the Chindamarch. Chindamarch and Chindam salt, because the shivering is there, proper shivering is there, the pain is fever is continuously getting. Even after 2-3 doses, the fever we can control it. Then Dextromica. Dextromica, we are not thinking about the fever. We are thinking about the gastric complaints. Am I right? Gastric complaints. But But Nexomic is very wonderful medicine for the fever with high chill. They are using 2-3 Campbells to reduce the shivering. That is the shivering of the Nexomic. That is the shivering of the Nexomic. Don't leave the Nexomic when they are any patient asking to wrap me up with the 2-3 Campbells with fever. They think about the Nexomic. After giving a 1 dose, they will tear out thrown out the Campbells, getting improvement. Then Parthas Bhairoji is foreign is the Paratram another one. So whenever we are not getting answer, there we can think about the Antimontataricum, there you can think about the Gennamal, there you can think about the Nexomica, there you can think about the Paratram Bhairoji. Paratram is also a very wonderful medicine for unknown reason of the temperature. I saved 12 patients with the Paratram. I saved 12 patients and a few cases with the Antimontataricum. This is my what is very informative thing. I'm taking this result since last my 45 years experience. In 1976, I developed this method, this protocol. I'm giving to you for your service. Maybe somebody knows this one. Those are my students, those are my friends, they know this technique. In my hospital, I usually follow 6 months proper protocol for the February conversion. The child is getting into our hospital with the February conversion. February, whenever they get fever, they get conversion. Here, 1 dose also there. Those who are having the very chubby patients, calcarea constitutions, there you can give a dose of calcarea, then tuberculosis. So there you can give the 7 months. Otherwise, 6 months is enough and more for the February conversion treatment. And after 2-3 doses, 2-3 months, they never get fever with the conversion, even 102, 103 temperature gets. It's Paka. It's Paka evidence. And give the guarantee that nothing, nobody will get there. Suppose anybody getting the conversion, that is not February conversion, that is converted to the epilepsy. Go to EEG, they will get the find out. Signs on the EEG find. So that's only few cases, no? Only 2-3% out of 100. Those are having the temperature waiting fever, the conversion after 3rd dose or 2nd dose, definitely can say the epilepsy. Send the patient to the for EEG, he will find out the EEG signs. Okay, so 1st and 2nd month, I am giving the tuberculin 1 dose only. 1 dose today night and then next month the same day, 30 days. 2 doses of 1 given. Then 3rd and 4th I am giving it tuberculin 10. 4th month, 3rd month and 4th month I am giving tuberculin 10. Then 5th month I am giving it tuberculin 50. There somebody is having some stories. And 6th month I am giving the tuberculin CM. Also we are getting some queries. Why you are giving this much set of hypotension within 1 month interval? Actually, fortunately, I got the action. So I am sharing it. Suppose you are assimilating your mind, you try it, you get the action. Otherwise, leave it. I not said anything, you will not hear it anything from me. Okay? But argument is not a proper thing. I not get you an answer. I developed this one like this and got the actions. These are the acute vibrate stage we are in. Again, we have the acute condition there. Renal colic. I mentioned my own story, the renal colic, ignition. Then other medicines are, proper medicines are there, Parsarla is there, Bellona is there, Rastoki is there, Tacus is there. These are the common medicines for the renal colic. Then Berberis vulgaris. Berberis vulgaris. These are the common medicines for the renal colic. Suppose you took the X-ray, the stone was more than 13 or 14 mm. There, suppose you are giving the medicines, the stone will come down and block the ureter. So severe pain gets, and that should be removed. There we should get give a technique. That type of, suppose we took the X-ray and KUB, we found that the more than 14 mm or 13 mm. Say about 1 mm, more than 1 mm. Up to 1 mm, we can exploit, no problem. But there are some, the Berberis hypotension is good. Lycopodium hypotension is good for the removal of the stones. And Parsala is also like that. Calcari also like that. One day I given a Parsala Calcari car when a lady who was from the USA. He is a friend of my brother-in-law. She gave me, sir, I am getting the stones every day, I'm passing it. Suppose your globules are there, the same size. Stone is passing every day. The factory is there, manufacturing globules outside the kidney. That's what happens. I given, so I tried. Suppose you are taking any, yeah. Somebody was given Parera, somebody was given Berberis. Somebody was one who I would say. She's telling that one. Okay, give it. I given a Calcare car 50 m 2 rupees. 50 m. On the next day onwards, the stone was passing. She took a 50 ml bottle full of stones. After passing this one, there's no production further happens. No production. Still she is living the New York without any pain. Last 2 months ago, I asked, you took the X-ray like that? No, sir. Nothing has happened. No passing of urine. This one. I asked her to check your serum calcium and phosphates so that we can control it further. Then she's advising me, no need of, sir. No need of. Everything is gone. See, that's why confidence is equal. With the Calcaric. So renal colic, my experience, hydrangea to break the stone. Suppose the stone is more than 11 mm, it will break into pieces, 2, 3, or 4 pieces, with the giving of hydrangea martinger. And hydrangea martinger 10 drops, every 4th hour they give it. It should definitely within 48 hours the stone will break. Then come down. Very easy. Then to accelerate your passing the stone, you give a dose of, suppose it is on the left side, whatever is vulgaris, 1000 or 10 must give 2 doses. The right side it is one, the lycopodium 10 or 50 you give. You can give and control it. Then another acute manifestation is the cholelithiasis. Cholelithiasis. The gallstone colic. Very miserable colic. The pancreatic colic. They're having not several cases, few cases I am having the pancreatic colic. One day one boy was taken to me from Bainat. They got the X-ray, plain X-ray, the abdomen. For there I have taken the ultrasound is there, CT scan is there. Even plain X-ray, I found a leaf-like white thing is across the abdomen. Across the level of where his umbilicus. Then I examined very hard. Then I examined the CT scan. They clearly said it's a pancreatic stone. Multiple stone formed as a single one. All the pancreas was covered with the stones. There, pain, suppose pain gets, the child is admitting in our hospital 4 or 5 times. When they are admitting the child, he is body has left to the upper portion and stand on the back, like that, for getting relief. In my hospital, I am admitting this one. 2-3 days I am admitting and getting cure, not cure, getting relief, they are starting. Again, after 1 or 2 months, they are coming to my hospital. The same thing is going on. That time, he is passing the small pieces of the stones in the stool. One day he got the by washing the stool, went to the rectal region, one hard piece of the foot in the hands, the child, the bone. Then examined is the calcium pieces. So that type of phenomena was taken to this child. Then I tried the calcarea force, calcarea force. Calcarea arts. Arts is a wonderful medicine. Calcarea force is suppose the constitution is then calcarea force will act. Calcarea arts for the pancreas. Cuprum arts for the kidney. Cuprum arts for kidney. Calcarea arts for the pancreas. Suppose I am giving the calcarea arts 30 potency every twice daily or like that. The stone was dissolving and getting out. Now the boy is coming to me. He got married. One child, his father one child also. No, nothing wrong. I do the X-ray and do the ultrasound. Nothing wrong with the pancreas. Properly working. And meantime, he got the diabetic also. Put the stone on the insulin is not producing properly. He got diabetic. After this passing in all the stones, almost all now, even the half portion will the diabetic also controlled. Now he is not getting any diabetic, properly getting relief. Not given the only the not calcarea arts, and I given the phosphorus also. One day with the pain, catchy pain, and constantly I admitted. Phosphorus also given. Then one day I given this tuberculosis also given with the night fever. Every day he getting the night fever with the sweating. That time I given the tuberculosis one, so that one stopped. After that one was calcarea arts he completely cured. Then another one appendicitis. I treated several acute appendicitis in my hospital. First case I remember, Alpi I was treated the 2-3 cases, but here after getting the Calicut, one day night by 11 o'clock, one girl child was taken to my hospital. My room. That time I have no hospital, only consultation chamber. They get it, sir, she got appendicitis. What to do? So they are admitted in the surgeon's hospital for surgery. The doctor was got some accident. So the surgery is not for me. The one nurse of the working there, he told me that better to see Dr. Ismail. Maybe you will get relief. So I examined the child and everything. I given the pulsar. I given pulsar 30 potency. 2 drops I am given the 1 glass of water. Every half teaspoon I given. Every minute and every 5 minutes I given it. After 5 or 6 hours, pain was come down. Then for recovering, I given the belladonna 1 hour. Belladonna 1 hour. In measles, I am got the experience. In measles, suppose I am giving the pulsar. Suppose some child having the re-attack of the fever. There I am giving the belladonna 1 dose. Even the belladonna is acute to the pulsar. Here it is actually chronic. I am given the belladonna 1 potency. So that the pain was completely relieved. I asked them to go to home and wait for the 2-3 days. They come back. After 4 days, After 4 days he came, no pain, nothing was. I started the again Pulsar 1, 2 doses with PLNSN, and asked him to take the 6 months same treatment. I given it for 6 months time. Every month they are coming, collected the Pulsar 2 doses with the PLNSN. They get in relief, completely gone, pain. So, such a characteristic medicine we have. One thing we have to find out, the technique of to find out the prescription. One day I examined the child, one appendicitis child, one abdomen. I just touch of the Arab region, right iliac postal region. She struggled. Just a touch like this. Just a touch like this. Having severe pain. So I asked him, suppose without any examination, how can I control this the disease like this? It's suffering. Then let me examine. Then I given the heart pressure. That time the pain was relieved. That time the pain was relieved. So wonderful. Again I removed my hand and touch on the region, the pain is good. When I get pressing on the reach, no pain. What's the medicine? Lachesis. I given the lachesis. Even then the appendix is not in the right side, left side. By biologically, the right side, no? Right side medicine. So lachesis is the left side medicine. Even then, due to the characteristic character of the pain, I given the lachesis, 200 potency, report relief. The same potency, same medicine I have given for 1 month, 200 potency once in the 5 days with the PL and SL. Next month I given the 1 month potency, 2 doses SL and B. I given the dose 6 months time. I am asking the 6 months time will take. Otherwise maybe recover. The attack will get it. So that type of practice and because of the every symptoms we should understand. And the lady having the severe appendicitis pain, she holding the one right leg to the floor, one surface. Left leg they are holding it like this, bending upside. One leg bending and holding it like this, and one over the flat on it. There I given the restox, anticoagulation, restoxy. The relief was pain, relief was good. The same medicine I given the further doses, completely gone. So that type of examination, that's what we observation, we should read it carefully, carefully. Then you will get the relief. Even Bellona will get it. We know the iris tenax is there. Iris tenax, specific for the appendicitis. Suppose one day I'm tried 2-3 medicines. I failed. Finally, I given this iris tenax. But because anything said in the mathematics as a specific, I'm not trying first. I'm trying the last time. That is my habit. That time I given the iris tenax. Good relief. Iris vertical on the head, and tenax on the appendix. And the lobelia inflata is the lungs. Lobelia is the earliness of the Homeopathic cancer. Both inflata, lobelia family. Lobelia inflata for the lungs, where we found very difficult to expectorate, very difficult to inhale, expire, and there we can think about the antimonium tartrate. But antimonium, earliness to mental cancer or colon cancer. That also belongs to our lobelia family, the small lobelia, especially those coming, they are cultivated in the Ceylon country area. Small one. The length is only 10 inches like that. The small one. That is the earliness. specific for the homoeopathic cancer. I cured many cases, not so many cases, but a few cases. And my brother also got this cancer, and beyond my advice, my brother-in-law's son was taken the surgery, and colectomy was done. That time I not found this one. I ordered in all over India, and all are sending to the village later. 30, 200, 3x, everything is sending it. One of my patients was there in California. That time he asked me, he called me, and I asked whether he will find out any illness in the California or somewhere. His husband was the one nurse. He got the infertility. I got it corrected, and they got child. Even then, the surgery is not performing the cesarean. Advice of the verbal advice I given to the phone, she delivered normally. That's a wonderful thing. Other things. So he find out this. He sent to the by flight. The third day I got it. I given the mention to my mother. See, this wonderful thing was happened. She passed the stool where they removed the area. They removed this colon, no? Get the colon cut short and tie up. After giving the illness, the remaining portion sector, they are passing the stool. Doctors are wondering. They are asking where from it comes, where it comes. So that's the type of action we got it from this revision. That's even that's the bottom was removed, the portion, the remaining portion was there, that portion, they are also it acted. Suppose I got the medicine earlier, my mother will say, unfortunately it happened. She died, he died under 3-4 days. So this type of cases I am handling it. This type of case I am got success. Every that I am then angina. Angina, but it was an acute case. In my hospital, I attended acute angina. Acute angina. It's more to be braveness of myself, the braveness of the patient who confidently believing me. Sir, you give medicine. I know, we know that they will get cured. Such cases they are giving to me, and my mother is an experienced one. I do to this one, I presented the cardiac cases with relation with what is the heading was given. Homeopathy medicine managed with the homeopathy medicine managed with the cardiac diseases. Washington. And in 88, I presented paper there. That time, my mother has the cardiac pain in 1975 and 77 and 76 and 77. 3 attacks. Mother had developing the pain, severe pain in the chest wall and with the clavicle region with a irritation cough, a noisy cough. Like that. Not soundful, but irritating cough. That is an nausea. That's a nausea. Nausea was given, the pain was controlled. Every time, the third attack was good normally. That also controlled with the nausea. Then, of course, I'm given the advantage. Vernal is also given. Kataga is also given. But centering the circulation of the heart. Katagas, Sildalis, and convalaria majalis, because my mother having the hypertrophy of the heart. So I tried this medicine, but finally the nausea was cured. Another clue I am giving relating to my speak. Any asthma patient comes to you, starting with the sneezing, coryza, cough, then asthma. There I am called that type of asthma, classical asthma. I am asking such patients, classical asthma. That's sneezing, coryza, cough, then dyspnea. Everything comes in within half an hour, or within an hour, 1 hour. Or maybe the morning they're getting released, evening get noon, evening cough, the night asthma occurs. Naja is the medicine. Naja. There you can try the Naja 200 once in 5 days, 1 dose, or once in 3 days, 1 dose, or followed by 1000 once in 10 days, 1 dose. After 2-3 months, maybe even the first month itself, the asthma is controlled. Such a experience I got it with Naja. Naja is our cobra, very poisonous subjects, things, but it is relieved with the game of the homeopathy for survival. Thank you. Then 1.5 hours is over. Anybody having any questions and queries, they can ask me. I'm not having any hesitation. Suppose I know the things, I will share it. Otherwise, I tell no. Frankly, I'm telling you. Anybody having any questions? With set items or any other items related with this one? Suppose I know something I forget to say many cases, maybe some the clues gets, I will ask, I will tell. Or even I'm out of my lecture, anything and you have any doubt, but don't ask the tubercle 50 cm why you are given 1 month interval. I took the bail, early bail. Jamiam Rajesh. Malayalam, then Jamiam, Munkut Jamiam. Early bail, I took. Don't ask a question because it's my experience. Suppose you need it, you believe it, give it, otherwise you leave it.
Sir,
Hello. Hello.
Sir.
My speak?
Yeah. I'm hearing.
Thank you, sir. A very nice and informative presentation, sir. Thanks to you.
Thank you.
Sir, I want to know a medicine, name of the medicine, which I couldn't understand. So initially during the dislike of food test and bad test or breast milk, when you were telling about the infant and mother and refusing to take feeds, some name was you suggested, Adam, or that I couldn't understand, sir. What was the proper name? What is, sir, please repeat it. Yeah.
Calcare carbonicum, and those who are having this anorexia, that's lycopodium 200 once in 5 days, then glycerin 30, glycerin 30 for getting putting weight as well as the appetite increasing.
Yeah.
And then calcare carb, one about the all type of the disagreeing with the milk, mother's milk and everything that. The mother having the child is not sucking the milk, we can try the calcare and also when to take bath every time you give the feed the child. Because the
and sir, what
having some bad smell, no?
Yes, sir. Sir, what about Jalapa?
Jalapa or Jalapa is crying all the night hours. Sleeps.
Crying in night hours.
Night hours.
Thank you, sir. So nice of you, sir.
Thank you. Then let me second one. Some Lakshmi, anybody there to guide them? Unmute your mic and ask.
Sir, good evening. I'm Dr. Lakshmi.
Yeah.
Sir, you said about a case of the colon cancer. I didn't
Yeah.
get the remedy, sir.
Colon cancer.
Yeah.
That is colon cancer is a very vast subject that we will discuss later. Even then, by the way I'm told my case of lobelia erinus. Lobelia erinus.
Lobelia.
Colon cancer with omentant metastasis.
Okay. 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 Thank you so much, sir.
Nimisha?
Sir,
Yeah.
sir, hello. Sir,
Yeah.
can you say medicines for gallstone colic, sir?
See?
Gallstone colic.
Gallstone, yeah.
Yes, yes. Sir.
Gallstone colic is cholesterol is there. I forgot to told that. Cholesterol 3x, wonderful medicine, peltory. Other medicine for the acute pain. Then pulsar like the medicine, dirty potency, gallstone colic. And gallstone colic, I have forgot to share my experience that I am going to tell them now. Write down for listening. See, you know the green apple. That's what it. Green apple, you know that small one, small green apple. 3 in number. You take and makes this pulse on by mixing it in the mixer machine. Add 1 tablespoon of the green vinegar, green apple vinegar. Green apple with the green vinegar. Green apple vinegar. Add this one every early morning by empty stomach. You take for 7 days, the stone will go. Along with our medicine. I think you understand. You got it. Am I right? You got it? Green apple, 3 numbers. Put some water and mix up the mixie. Then add 1 tablespoon of the green apple vinegar. Early morning by empty stomach. Take for 7 days. All stone will dissolve and pushed out. Good job.
Good evening, sir. Good evening, sir.
Good evening.
Excuse
Good
me.
evening.
Sir, how do we manage sudden sprain?
Sudden sprain.
Yeah.
Sudden pain means a positive factor there. Suppose you are having you're taking anything from the upstairs or just tilting them sideways. Think about the rest of the ground. Or you are walking and slipping your tongue, slipping your legs or the head. You think about the arnica. 200 potency.
Okay, sir. If it is ankle sprain,
Angle, Ledam ball and the arnica is the first one. Suppose arnica is not relieving fully, you give a Ledam ball, 200.
Okay. Oh, okay, sir.
Okay.
Thank you, sir.
I'm hearing. Tell me.
My pleasure, sir.
Yeah.
Sir, regarding renal calculi,
Yeah.
your good self told that hydrangea is a very good medicine to break the calculi.
No, not calculus. Breaking the calculus.
Breaking the calculi.
Yeah.
Yeah, breaking.
Suppose it is a very big one. Because I break down in 2.6 also. With the hydrangea. 6.6, 2.6, sorry. 2.6 centimeter. They break into
2.6 centimeters.
Yeah.
And
I break
sir,
it because they are not going for surgery. I asked them to go for surgery, but they denied it. Again, pain comes. Again, they are coming to me, disturbing me. Finally, I thought that maybe I take this hydrangea. I go on the hydrangea every 10 drops every 4th hourly. And finally, what happens after 3-4 days? The small pieces coming out. Then I
Sir,
took the KUB scan. It was filled with all the ureter. Then again, I admitted him to my hospital. Even the IV, fast. That means one bottle and you finish it within 20 minutes.
Fast therapy.
I given 5 bottles. The whole stone was gone out. That also I'm practicing here. Suppose anybody having this 10 mm or 12 mm stone, I'm giving this whatever is hypotency or Lakapuri hypotency or calcarea hypotency, whatever they need it. I given this one IV also. That is my practice. Every time I'm giving the IV. IV throat. Throat means fully I open the nostrils. So within 20 minutes, 1 bottle was finished. So within 80 minutes, 4 bottles finished. That hydrogen I given the 5 bottles. Usually I'm giving 4 bottles only. Definitely the stone will come in at least in the bladder. At least in the bladder.
Thank you, sir. This was my question, that up to what size we can take a patient, and you gave a very
2.6. For breaking purpose, 2.6. That's my maximum.
Yeah. Thank you,
That's
sir.
why I
I'll take the
refuse to-
patients now. I refuse to the
That's why I
patients.
refuse it. But due to this one, where given it. So
Amazing, sir. Amazing.
Hydrogen, the mathematics also they're selling the stone breaker.
Thank you, sir. So nice
Yeah,
of you,
go
sir.
through this mathematics, yeah, you said like that. Stone breaker.
Thank you.
Thank you. And Anand, by Judge Paul was there. I think nobody is about controlling. Manoj, Ashik, very.
Hello.
Yeah.
Hello, doctor.
Yeah.
Can I speak to you?
Yeah.
Okay. I am from Ambalapura, Dr. Hariharan. I want to know, doctor.
Yes. Old Hariharan.
Old Hariharan. That is old Hariharan. Sir,
I know.
Sir, pain due to cone. Pain due to cone at the foot. Severe pain due to cone at the foot. See, certain patients complain severe pain, but see, can we relieve the pain?
Ladambal is there. Ladambal is there. Rastox is there. One new medicine was there, which was proved under my guidelines. One of my PG students, that is Sida.
From which
Sida means nothing but your Kurdoti.
Oh, Kurdoti. That
Homeopathy now it is available in the Comco and some other practices are manufacturing this one, but it's not accepted by this one our pharmacopoeia. Pharmacopoeia need 3 proven report. They are given only one. So due to the action of this one, according to my advice, the Comco was manufacturing this one. Dr. Pragashan also manufacturing this one. Dr. Sento also manufacturing, I think so. Some other. No.
Okay.
Yeah.
Doctor, another question.
Yeah.
See, certain children are complaining abdominal pain. On examination, we can't find out any pathology, but one pathology we can find is mesenteric lymphangitis. Lymphangitis. See, can we treat the
I treated several cases.
Because
that poster is coming, you give a dose of medorinum. 10 potency, medorinum, then acute medicines according to pain relationship.
Oh, in order to cure that patient for lymphangitis, Medorina itself cure the lymphangitis.
Cured. Suppose that symptom gets, Medorina will cure.
Okay.
Even asthma, any colic. Suppose the child or man having that position. That is Islamic prayer position. That's it. Mathematics also written like that. Islamic prayer position.
Suppose
Sujood.
it is suppose
Sujood.
it is tuberculinic.
Yeah.
It may
I
happen.
got cure. I heard the report also.
Okay, okay. So next is see carpal tunnel syndrome, pain
Carpal tunnel,
against
yeah.
the joint.
Yeah,
Which are the medicines?
we have several medicines. We got more cure. A single
Okay.
doses of Silesia 10M
Hypertensive.
potency. Silesia 10M.
Okay.
First of all, suppose any acute pain comes, we can think about the rota. Then followed by this Silesia.
Next question, sir. See, suppose certain heart patients have taken this see their what is that for the heart attack? Some implement some implement is in their veins. What is that? I'm not remembering now. And that patient when they comes to us. That can be the Silesia.
What type of heart patient?
Angiogram. See,
Angiogram block.
Angiogram.
CAD.
Angiogram.
CAD, we have medicines. We have medicines. Wonderfully, we can cure it. I have several cases with the report.
Okay. Okay, thank you, doctor.
Lactodactus mactans for relieving the pain. Lactodactus mactans
Lactodactus mactans. Oh,
is for the pain relieving, followed by concentration medicine, calcarecar, phosphorus, lycopodium, whatever comes, you can give it. The pain will go, the CAD will get cured. Usually to me, it is a triple vessel disease will coming. Triple vessel.
Okay. Doctor, after this cardiac surgery, can we give the Silesia hypotensive? It will do any harm for the patient?
No. Because hydration you have to give very carefully. Because the CAD also a foreign body, no? Suppose it's escaping very speedily, maybe rupture of the vessel will come.
Yeah.
Then logically you think about it. Logically.
Okay.
There you give some other these medicines, mother tinctures, cratagus, and sumbul. Sumbul is a kind medicine. Sumbul, you know? SUM.
Sumbul.
Yeah. That every 7 drops every 3 hours or 3 times a day. It will dissolve this stone and then making shorter the stone. Then we can spread.
See,
there we have to give some conscious.
So, doctor, another question. See, do you have any experience with the leukoderma?
Leukoderma, yeah.
Yeah.
Leukoderma, we have.
So, what is the protocol?
Leukoderma, bilateral, symmetrical. First of all, I give one clue. Bilateral, symmetrical as it is same. Said.
Okay.
You can think about the syphilinum.
Okay.
Bilateral, but not symmetrical. Bilateral may be distributed there, but not symmetrical. That sepia will come.
Okay.
One side is only lycopodium will come. Calcarea carb will come.
Okay.
No more medicines. Only limited medicine we have.
See,
but if patiently you give it, you don't expect any curative action within 1 month or 2 months.
Okay. Long-term treatment. Long-term treatment and positive treatment. I see how the arsenic album, arsenic.
It's a useless medicine, but we can give it wonderfully with cure where the lepromatous vitiligo. Lepromatous vitiligo, you know that?
Okay.
The same side having the itching and thickening of the skin will come. There you can give the arsenic sulfate.
Sorry, doctor. See, please. See, I have a patient and I cured the. I mean, not
maybe cure, but it is not a wonderful medicine.
Okay, Okay, but that
Yeah,
patient,
okay. But
that
in mathematics, everyone telling about the arterial flower. But I am giving limited to the those who are having the skin complaints with vitiligo, epidermolysis.
okay.
That's a very rare one. No? That was the cure is very difficult. Cure is wonderful.
Dr. Ravi, next question. Certain children have, there is not white discoloration on the skin, not white,
Uh-huh.
but it is dull white. See, certain children at their body, there
Ah.
is dull white markings, dull white
That
markings.
is fungal infections. There we can give the bacillum, calcare
Okay, thank you. Bacillum, see, doctor, very correct. Very
bacillum
correct.
tendum, then
Okay.
calcare tendum. Then there's only
Okay,
fungal.
Okay. Correct. See,
Okay,
maybe
okay.
fungal.
Sir,
Okay,
we
sir.
need to
Okay. Yeah, leave it. Thank you, doctor. Thank you, doctor.
Thank you.
Doctor.
Okay. Next, I call upon Manjula, Dr. Manjula.
Somebody
Ma'am,
will
you
slide
can
a follow so
talk.
that everybody is satisfied.
Yes.
Sir, maddening pain, ignatia, which potency, sir?
200.
Repetition?
Repetition, even 5 minutes you can give. But in my case, only one dose was enough. Within one dose I cured. But several other cases I given it half an hourly and they. But if it is very indicated, within one dose it will relief.
Okay,
Don't need of any further doses.
Sir, for leukoderma, which potency? Syphilinum, sepia, which potency?
10
Okay,
Start with
sir.
the 10 then go to high potency after several weeks, several months.
Sir, one more question. Angina, acute angina, nausea, which potency?
30 potency. 30.
Okay, sir. Thank you.
Okay, thank you, ma'am. Now it is Anand Jeswal.
Hello.
Yeah.
Hello. Good evening, doctor. It's a very
evening.
wonderful session.
Thank
It's
you.
value for money, and I think it's just very, very informative.
Thank you, sir.
You share your 50 years experience in a 50 minutes. It's a very big deal, sir. Sir, I have a question regarding I have a kids 3 months who can't suck mother's breast milk. The mother pump their by breastfeed. Is there a calcarea carb work or something ending, sir?
Is it lack of milk or something like?
Sir, lack of milk initial time.
Yeah.
Now
Maybe
milk
lack of milk. You
is
do one thing.
sufficient.
You try Asafetida 30. 3 times daily for 1 week. The milk will increase.
Okay, sir. Now milk.
Otherwise, I asked one. I said some food also. One food. I think you.
Yes,
yeah, badam pista. Therapy.
But sir, now milk is sufficient. The child is not take a nipple to your mouth. The ma'am feed by their bottle by breast pump.
Maybe she has some smell in the breast area. Bad smell. That's why the child is not tolerating. Suppose if we taking in the glass or taking there's no smell is coming out. So ask the mother to wash the breast before feeding.
Okay.
Or take a good bath with a good soap.
Okay, sir. Now, sir, our next question. In case of spinal stenosis by slip disc, there is extreme pain. Sir, can you suggest some medicine?
Severe pain in the lumbar area.
Lumbar due to slip disc, yeah, spinal stenosis, yeah, something.
I'll give you one wonderful medicine. Antimonium tartaric 10
Antim tart.
10 potency. Not 200, 2000, 10 potency. Give it 2 doses with the interval of 4th hourly. Definitely you get relief.
Okay, sir. Sir, it is for spinal disc. Yeah, something. Spinal. It is for spinal disc, slip disc, stenosis. all cases?
Yeah. But there you can give the further medicine. This is only relieving the pain. Cynosure will get, Ecladaba will come. Ecladaba, Cynosure, Calcareca. That you find out the according to the constitution.
Okay. Okay, sir. Thank you, sir. Thank you.
Thank you.
Okay, next I call upon Sri Lakshmi Shankar.
Good evening, sir.
Good.
Sir, a 6-year-old child, sir, he's eating sand, stones, then pieces of wall. So what medicine can we prescribe for the child?
I'm not understanding what is the question. What's the question? Once more, sir. Your question, please, once more.
Sir, a 6-year-old child, sir.
16-year-old child, yeah.
She's 6-year-old child. She's eating sand, then stones, pieces of wall.
Okay. And first of all, you ask the mother to give the good food instead of this stones. Then you give the
appetite also.
Yeah, calculator.
Okay. Okay, sir. So which potency?
One. You give it once in 10 days, 1 doses. 2-3 months it will come. If it is a child eats earth also, then acid nitricum. Then
okay. Sir, there's another case of ganglia on the wrist, sir. With our medicine, the size has reduced, but the patient is having radiating pain to the arm. Severe pain the patient is telling.
Which finger? Thumb.
Sir, on the wrist, sir.
First finger. Ring finger or thumb?
Sir, on the wrist. Hello?
Yeah.
Sir, on the wrist, sir.
Wrist?
Yes, sir, wrist.
Where the gangrene is there? I think you are telling them gangrenous growth and reducing.
Sir, ganglion.
Ganglion, oh. That's Alicia.
Okay,
and Zingam metallic also good medicine. 30 potency. Alicia, high potency, 10 is enough.
Okay, sir, okay. Thank you.
Thank you.
Okay, thank you, ma'am. Next I call upon Badranji.
Thank you, Dr. Ismail Sait, for
Thank you.
For your wonderful presentation and experience sharing. I would like to know whether you treated the aortic aneurysm successfully.
Yeah. Aortic aneurysm means whenever you get an aneurysm anywhere, either in the brain or heart or inguinal region, think about the Barretta muraticum and Barretta carbonicum. Carbonicum with the low pressure, not low pressure, normal pressure, and Barretta more than high pressure. In the brain aneurysm also, I got cured, and within inguinal, right inguinal region, one of my peon has having this one. I given the Barretta carbonicum that time. That time he is undergoing the surgery for appendicitis. When I am examining the pulsation, I got it. So I asked the surgeon, sir, I got the pulsation in the region. Can you see one more time? Pulsation? Yeah, pulsation. So we examined and oh my God. Without knowing this one, I suppose put the surgery, maybe he died. Such a big aneurysm swelling was there. Pulsation, severe pulsation he got it. One of my peon, Bharathan, our hospital, peon.
What's the suggested potency in
30.
30 is enough.
Wherever they had head or say whatever, the 30 potency good.
So also in case of hemorrhoids with I got to mention
Hemorrhoid.
hemorrhoids.
Hemorrhoids.
Hemorrhoids and fistula.
Is it bulging out or not? Inside or outside?
Outside.
Outside. Whether any relation with the stool passing or something there?
Occasional discharge of stool or pus-like matter discharging.
So, see, Allosopotrina, very wonderful medicine for even for the rectal cancer.
Which potency, sir?
Start with the 30 potency.
30.
Go to high potencies, even 50 mcm.
Fistula also.
Fistula also, first of all, think about the silicea. Then, if suppose they get any consistent medicine, it change to that medicine. Silicea is good. Silicea 10 potency.
Silicea 10.
And fistula, one sinus and fistula are giving another advice. All allopathy doctors want to sit on the hot saline water. Am I right?
Okay.
But it is not advisable. You cannot cure it in the time of his life. Because every time he's sitting on this water, some water goes inside. But infections. Of course, relief is there. We will get a relief. But again, the infection continues. You never escape with the infections. And there you advise the patient, make a cloth, used cloth, that is tortle. Used cloth. You just wash it out and put into the hot water, saline. That is kalup, natural salt. And they put the cloth into the one, then use it, make it round shape, and sit over this one. Due to the osmosis theory, all pus is coming out in the clothes. Every day you have to do it. Within 1 month, the size of the fistula, the size of everything is reduced. Infection shall be controlled. Otherwise, it will go for years.
Yes, no.
Even my now I told you to the things to my allopathy friend, they are also started this one.
Sir, what's your experience with pilonidal sinus? Pilonidal sinus.
That also sulfur and silicea.
Sulfur, silicea.
Yeah, sulfur is good medicine because maybe they got some burning in there.
Burning.
Burning, so they get the sulfur. Maybe sulfur is not cured. After that one, silicea is like silicea mechanical medicine. Brought by silicea.
Thank you, sir, for your earlier suggestion.
Thank you.
Thank you.
Next time you actually give me the feedback, then only I will confirm myself. No?
Okay, next is okay, I think she is not there, so I call upon Ganga K. Murthy, Dr. Ganga.
What?
Hello, good evening, sir. Sir, thank you so much for the class. Actually, I am getting into my daughter's case. Actually, because of her job, we had to go for her first COVID vaccination. So we took the vaccination 1 month back, and after on starting itself, she got an allergy in the eye and an oral thrush. But that it went off with some of our medicines. And immediately after vaccination, I gave Tuja actually. Maybe that didn't worsen the case. Actually, the third week, what happened? She developed some from the lumbar region to around iliac to hypogastric region, a hemicircular herpes-like pain. Means severe burning pain was there. but herpetic eruptions were not there. Only some 1 or 2 macules were there. So we were confused actually whether it is, but the pain was severe. So I gave meserium at that time, and actually maybe that cut short the case. Later it developed. Then she was getting the pain. The pain was getting worse and worse, and she developed some sensory issues also. So we took her to a neurologist, and the neurologist examined, and he suspected transverse myelitis. So I was so panicky, and we went for, he suggested MRI, and we went for MRI. Luckily, thank God, in MRI report, everything was clear. Central nervous system was clear, including spinal cord. So we didn't take any of their medicines, and with my other friends' help also, I was treating the case. Around for 7 days, more than 7 days, she was having very high fever, and the fever was touching 105. It was running, and maybe that the reverse process in our theory, it came out as fever, I think. So it's slowly getting relieved, and on the 10th day, her fever subsided. 99, 98 continued for 2-3 days, and then got over. Then after that, she developed some pain in the that burning pain, that tingling sensation, that reduced, and in the lumbar area itself, she developed a sensitive. That area is very sensitive. If we touch there, she is very sensitive to touch in that area, and accordingly, acute medicines like agaricus, hypericum, and arnica, that were given afterwards. Then when that also got subsided, my friend took the case and gave lycopodium. And lycopodium, with lycopodium, she got all the other symptoms also, the basic symptoms also got increased, maybe homeopathic aggravation. And slowly that was also getting, now it is 13th or 14th day today. And today she is okay. That back pain sensitivity is there if we touch. But in the front region today, she developed mild, that tingling sensation below that. So now what we should do, doctor, whether we are going in the right way?
Whether it is having the coccydynia, coccyx area is painful?
No, coccyx is
No,
okay. No.
Then straight away give it to Silesia.
Silesia,
10
okay.
you give, wait for another 3 weeks, it will completely cure.
Okay, doctor. So the homeopathy saved her life actually.
Because the Tuja, Silesia, anti-Montata is a bad effect of the vaccination. First of all, even the you were given what medicine you were given? Tuja. There, not Tuja, the Silesia is coming.
Okay.
Only given Tuja. Again, you the Tuja, the Silesia will come up. Okay,
now with a dose of Silesia, it will be cleared, right?
10 or 2 doses.
10
Wait for 3 weeks, completely will cure.
Okay, doctor. Thank you so much.
Follow me,
Okay, sure. In the group, I'll do the follow-up. Doctor, actually, some other cases I have, I got the information that same case, the same type of pain, they were under neurologist treatment only, and demyelination happened now on steroids, and it got worsened and worsened. So that meserium at that correct time helped our child actually. So thanks to homeopathy and thanks to Hahnemann.
Okay, thank you,
Thank you so much, sir.
Very wonderful medicine.
Yes, sir.
Okay. Now I call upon Shubhangi. Dr. Shubhangi.
Hello.
Yeah.
Hello. Good evening, sir.
Good evening.
Sir, how can we treat injuries with severe pus formation?
Injuries with the severe
pus formation.
Definitely we got the calendula, no? Why not forget the calendula? 200 potency. Sterile wash.
Okay. So
sterile wash, don't put any calendula in there. You wash the calendar tincture. The water you just add the either salt water or calendula, 3 or 5 drops only. Then wash out and sterile wash, sterile packing. Then give calendula 200 every 6 hours.
Okay. Okay,
After
sir.
20 days, I think more than 50% will relieve.
Okay,
And
sir.
again, you
So,
give it and another some potencies will cure.
okay. So there is no need to prescribe silicia or sulfur in that case,
No,
or
no, no, no
arnica?
need. No.
No.
And the granule itself will cure.
Okay, sir. Then when should we consider about silicia in pus formation?
ഞാൻ എന്റെ മീറ്റിംഗ് കഴിഞ്ഞതാണ് ഒരു 10 മിനിറ്റ് കൂടെ നീണ്ടുപോയി From Toronto, my brother is calling. Yeah.
Okay. Sir, my question was when to consider silicia in pus formation, in which condition?
What? I'm not understanding.
Actually, in our books, there is given that silicia we can use in pus formation. So in what condition we can use silicia?
If any pus is collecting inside, not coming up, the infection is there, fever is going on. So there we can drain out the pus, can give the silicia. Suppose the area is very sensitive, very painful, give the low potency of the epasulfurium. 3x or 30 or like that, it will come out. Break this one, the pus will come. After that, we give the silicia high potency, so it will clear.
Okay.
With pain less, you can think about the silicia.
Okay.
Okay.
Thank you so much, sir. Thank you.
Okay, now next, Dr. Daryamin. Dr. Banu, please unmute from your side and talk.
Hello, good evening, sir. It's very excellent session. Sir, my doubt is like, sir, please tell the protocol for fibroid uterus. Fibroid uterus, sir.
Yeah. Without any hesitation, if you want to remove it up to 4 centimeter, clearly we remove it by medicine, our medicine. Suppose it is more than 4 centimeter, some calcification ring was formed in the around the fibroid. So sometimes it breaks up and cure it, otherwise not go surgery. But 6 also is cured. But it's I'm telling them, it's a 4 I'm getting clarity. Suppose you need my medication, I'll give 1 or 2 medicines. Then 1 or 2 medicines, a month medicine, the breaking happened, we can cure, otherwise how to go for surgery.
So what?
After
what
4 we can give. Yeah,
what
after 4 you can give according to the symptomatology. Conium will come, Cilicia will come, Calcaria will come, or the medicine will come. Okay.
Okay.
Okay, thank you, doctor. Now I call upon Dr. Suma.
Medicine for easily bleeding comes with pyorrhea.
Gum bleeding.
Yeah.
Gum bleeding, suppose you are getting very offensive there. Where from the blood comes from area, maybe it is very offensive. Blood is very nasty thing, no? There you can think about the creosotum. Creosotum, very offensive bleeding from mouth, and even your
Okay, sir. I will try creosotum 200, but not relieved.
200 will not work. 200 will not work.
Okay.
Then potency give 10
Single dose, sir?
2 doses, late and morning.
Okay.
Late and morning.
Okay, sir. Thank you.
Okay, thank you, ma'am.
Can I leave?
That, sir, shall we close the session? There is no more.
Yeah, that's fine. Because somebody is waiting for me for a from Toronto.
Okay, so
Anil Kumare, Kumara, Anil Kumara, കുഴപ്പമില്ലല്ലോ അൺമുട്ടായല്ലോ ആണല്ലോ.
Sir, everything okay. Very best.
Okay, okay, okay.
Okay, sir.
You
So
feel me
next
as
Sunday also
energetic?
you will continue.
You feel I am energetic?
Yes, yes. Only,
Thank you.
only some coffee
Thank you,
there.
thank
You are
you.
everything. Still you are everything. Okay, sir.
Thank you, thank you.
So everything okay, sir.
Thank you. So
Can we leave? Okay, sir.
yeah.
Bye.
You will see you
Okay.
on the next 7th.
Yes,
Yeah,
Saturday.
7th, 3 o'clock. 3 o'clock.
Saturday.
Saturday, 3
Because
o'clock.
yeah. Because
No,
Sunday I have the practice at Toronto and Coimbatore.
Ah.
The next Saturday, then again Sunday 15th.
Sir, next Saturday 2 p.m. Isn't it?
2 p.m. 2 p.m. You.
2 p.m.
I can't
Yeah.
limit the. Oh yeah, okay. I will try to come earlier. Okay.
Yeah. Because
will control it.
everybody have consultation on Saturday by 4:30.
Maybe.
All doctors have consultation. So we have to change the time to 2 o'clock.
Okay. I try to. Okay.
Okay, sir. Thank you.
okay, thank you. Have a good day.